Worldwide, we are faced with the challenge of preventable medical errors. This is primarily due to the fact that knowledge is now expanding at an exponential rate. We have, back in the 1950s, we used to have medical knowledge that used to double every 50 years. But in 2020, by some estimates, the same knowledge will double at a rate of 73 days. So every 73 days, you will have knowledge, medical knowledge, all that we know about medicine, health and healthcare, moving from X to 2X. On the other hand, we have the challenge of diffusion. That is, how long does it take for knowledge to move from theory to practice? By some estimates, that takes as long as 17 years. So on the one hand, you have knowledge doubling at such an exponential rate, and second, you have this challenge where you're not able to practice what's known in terms of theory. So this is what I call the knowledge dilemma. The knowledge dilemma can only be, the gap can be closed only with solutions that provide current, credible, evidence-based information at the point of care. So this essentially bridges the gap and makes sure clinicians are provided with the best knowledge to enable them to ensure that they provide quality care and also optimize the cost of care that is involved. Now, we talk about clinical decision support as the cornerstone in providing high quality, cost efficient care. Clinical decision support has at the heart of it evidence-based medicine in terms of clinical guidelines, order sets, care plans, clinical reference solutions that at the point of care empower the physician. There's a lot of talk of artificial intelligence, and there's a lot of promise in terms of what it holds for medicine. But I like to think of artificial intelligence as something that will be successful in the near term in things like autonomous cars. But as far as medicine itself is concerned, I'd like to think of intelligence in terms of intelligence augmentation. So I like to talk about IA as opposed to AI. Now think about a physician who gets knowledge in terms of the sea of information that's available, and that's actually consolidated and made available to him in the form of order sets, like a checklist of orders in terms of what he needs to do for a patient of chest pain who comes in, and to make sure that he doesn't miss out on the possibility of the patient having a clot in his lung vessels, pulmonary embolism. So the doctor is reminded of ordering a test called D-dimer. So that's a test which is part of the order set for chest pain as well in terms of the differential diagnosis. So such order sets, which are based on current, credible, evidence-based information, can really transform the process of care and really transform the way quality care is delivered. So we at Elsevier also ensure that we provide this knowledge in terms of credible information solutions, evidence-based information solutions in the form of order sets, care plans, clinical pathways, and reference solutions as well.